Welcome to section 18 of metabolism. In this section, we'll be discussing amino acids. Let's get started. This is the metabolic map provided in section 1 of metabolism. In this video, we're focusing on amino acids. The amino acid metabolic pathway can be seen right here. It will also include a little segment right here that is in the homocysteine metabolic pathway. Let's zoom up on these pathways so you can see what I'm talking about. This is a detailed figure of amino acid metabolism, which can be found in section 18 of metabolism. Notice that there are 4 stars right here, and these correspond to metabolic disorders. You can also see that many vitamins right here are necessary in these metabolic pathways, which we'll discuss more throughout this section. Okay, let's start by discussing maple syrup urine disease. In the section on homocysteine metabolism, we discussed how homocysteine can be converted into propionyl-CoA. It's also important to know that valine and isovaline, which you can see right here, are converted into alpha keto acids and then propionyl-CoA. Eventually, they're converted into succinyl-CoA, which is part of the TCA cycle. As you can see from the figure, the conversion of the alpha keto acid to propionyl-CoA occurs by the branched chain alpha keto acid dehydrogenase complex right here. Also notice that leucine and isoleucine up here can be converted to an alpha keto acid and then to acetyl-CoA, and this also occurs by the branched chain alpha keto acid dehydrogenase complex. So hopefully from the figure, you notice that isoleucine is a bit unique because it can enter the TCA cycle as either acetyl-CoA or as succinyl-CoA. Maple syrup urine disease is due to a deficiency of the branched chain alpha keto acid dehydrogenase complex, or BCKDC. This results in defective metabolism of isoleucine, leucine, and valine. These amino acids are known as the branched chain amino acids. Similar to pyruvate dehydrogenase and alpha-ketoglutarate dehydrogenase, BCKDC requires the exact same cofactors, which can be seen right here. So vitamin B1, lipoic acid, CoA, FAD, and NAD. These cofactors can be remembered with the mnemonic TLC for Nancy, which we've talked about in other videos. The T stands for thiamine, the L stands for lipoic acid, C stands for CoA, 4 in the mnemonic stands for FAD, and Nancy in the mnemonic stands for NAD. The alpha keto acid metabolites of isoleucine accumulate in the urine and are responsible for the burnt sugar smell that gives the disorder its name. Finally, the disease results in an accumulation of alpha keto acids, which are responsible for the neurological symptoms associated with the disorder. These include intellectual disability, seizures, and irritability. As you can see from the figure, each of the branched chain amino acids are converted into an alpha keto acid before the BCKDC can further metabolize the amino acid. Notice that a defect in BCKDC, right here or right here, results in an accumulation of alpha keto acids. This metabolic derangement is responsible for the symptoms seen in maple syrup urine disease. Also notice from the figure that each of the vitamins associated with BCKDC we just discussed are shown at the bottom right side of the figure, right here. Okay, let's do a question. An 8-month-old boy is brought to the physician by his mother for seizures. She states that she hasn't recognized any prior seizure activity until recently, but notes that he has been very irritable since birth compared to her other children. A sweet smell is noted while changing the boy's diaper during a brief genital exam. An enzyme deficiency is suspected as the cause of this patient's symptoms. Based on your understanding of the most likely deficient enzyme, what supplements may be helpful in improving this patient's condition? From the question, hopefully you notice that this patient has had neurological deficits, including seizures and irritability. Also, a sweet smell was noted during a genital exam, which is likely due to an abnormal substance in his urine. Neurological deficits and a urine that has a sweet smell should make you think of maple syrup urine disease. We're told that an enzyme is deficient and asked what supplements may be helpful. From the figure, notice that maple syrup urine disease is due to a deficiency of the branched chain alpha keto acid dehydrogenase complex, right here and right here, as we've been discussing. As we can see in the bottom right side of the figure, this enzyme requires 5 cofactors. We can see 4 of them right here: thiamine, riboflavin, niacin, and pantothenic acid. Not seen in this figure is lipoic acid, which is also required. By administering any of these cofactors, the activity of the enzyme complex would theoretically improve. However, in actuality, thiamine is the only vitamin that is used clinically to improve this condition. So in answer to the question, thiamine can be used as a supplement to improve this patient's condition. Okay, now let's discuss the metabolism of phenylalanine. From the figure, notice that phenylalanine is converted to tyrosine by the enzyme phenylalanine hydroxylase. Also notice that this requires tetrahydrobiopterin, also known as BH4. You can see that BH4 gets converted to BH2, and then BH4 must be regenerated by the enzyme dihydrobiopterin reductase right here. This means both a deficiency of phenylalanine hydroxylase or dihydrobiopterin reductase can both result in phenylketonuria. Notice that both of these have stars next to them and correspond with phenylketonuria right here. Also notice that if the metabolism of phenylalanine is impaired, then this results in a deficiency of downstream substances such as tyrosine, melanin, dopamine, and epinephrine. Recall that melanin is the pigment found in melanocytes. In phenylketonuria, patients can have impaired melanin synthesis, which can result in a fair complexion. Additionally, impaired synthesis of dopamine, norepinephrine, and epinephrine can cause progressive neurological decline. This is why it's important for these patients to receive the necessary dietary supplements. Okay, let's see what your text says. So phenylketonuria is caused by a deficiency of phenylalanine hydroxylase or dihydrobiopterin reductase. This results in downstream deficiency of neurotransmitters. Symptoms include seizures, intellectual disability, and a musty body odor. Treatment varies depending on the specific deficiency. This last point is particularly interesting based on what we just covered about how 2 enzymes are necessary for the metabolism of phenylketonuria. So depending on the exact deficiency will dictate treatment. The idea of a dihydrobiopterin reductase deficiency causing phenylketonuria is very high yield. Let's take a moment to dive into this in a little bit more detail. This is a detailed figure of the amino acids that require dihydrobiopterin reductase for proper metabolism. This can be found in section 18 of metabolism. Notice that phenylalanine, tyrosine, tryptophan, and arginine all require BH4, and that this must be regenerated by the enzyme dihydrobiopterin reductase. You can see that in all of these reactions. That means if this enzyme is deficient, a patient could present similarly to classic phenylketonuria, but would also likely have other signs and symptoms. For example, in addition to elevated phenylalanine, the patient would also have a serotonin and nitric oxide deficiency. Also, in classic phenylketonuria, tyrosine can be supplemented to the diet, which can help resolve the symptoms. In dihydrobiopterin reductase deficiency, however, supplementation with tyrosine will not improve the condition because tyrosine still cannot be converted to DOPA. Notice that this step here requires dihydrobiopterin reductase as well. In this particular disorder, the treatment involves restricting phenylalanine and supplementing the diet with BH4. Finally, a quick note before we move on. Notice that tryptophan right here can be converted into niacin or serotonin, and that both of these reactions require vitamin B6. Additionally, the conversion of tryptophan to niacin also requires vitamin B2. Okay, let's move on to catecholamine synthesis. So as we just discussed, phenylalanine is important for catecholamine production because it's responsible for the synthesis of DOPA, which is the precursor for catecholamines. From DOPA, dopamine is synthesized by the enzyme DOPA decarboxylase. Notice that this step requires vitamin B6. You can see that right here. And also notice that this enzyme is blocked by the drug carbidopa. This drug is used in the treatment of Parkinson's disease. This section is not meant to be focused on Parkinson's disease, but you should recognize that carbidopa works by preventing the peripheral conversion of DOPA to dopamine. This means more DOPA can enter the brain, which can then be converted into dopamine, which can alleviate the symptoms of Parkinson's disease. From dopamine, norepinephrine is synthesized and then converted into epinephrine by the enzyme phenylethanolamine N-methyltransferase, or PNMT. Notice that this step is upregulated by cortisol. This makes sense. When the body is stressed, it releases cortisol, which can upregulate the synthesis of catecholamines, which augments the fight or flight response. Okay, let's move on to albinism. From your text, we can see that albinism is caused by a deficiency of tyrosinase. This results in decreased synthesis of melanin, but a normal number of melanocytes. Because these individuals lack pigmentation, UV radiation can be more teratogenic, resulting in an increased risk of skin cancer. From the figure, notice that a deficiency of tyrosinase, right here, can result in albinism. Okay, let's move on to discussing alkaptonuria. Notice that once phenylalanine is converted into tyrosine, this can undergo a series of reactions before entering the TCA cycle as fumarate. From the figure, you can see that in this series of reactions, homogentisate, right here, is converted to malacetoacetate by the enzyme homogentisic acid dioxygenase. A deficiency of this enzyme results in alkaptonuria. Okay, let's see what your text says. As we just saw, alkaptonuria is due to a deficiency of homogentisic acid dioxygenase. This results in increased homogentisic acid, which can be deposited as a pigmented substance in connective tissue. This can sometimes manifest clinically as pigmentation of the ears or the sclera. Deposition also occurs in the joints, which can cause arthritis. Finally, the acid accumulates in the urine, and when it's oxidized by the air, it can turn black. Okay, let's do a question. A 6-month-old boy is brought to the physician for seizures and developmental delay. His parents state that they adopted him from out of the country and he was brought to the United States a few weeks ago. On exam, he has a musty body odor and a fair complexion. An enzyme deficiency is suspected and dietary restriction along with tyrosine supplementation is recommended. However, the parents returned 2 weeks later due to worsening of his condition. Based on this patient's enzymatic deficiency, how would smooth muscle relaxation likely be altered compared to a healthy individual? If we look at our overview figure, we can see that in classic phenylketonuria, restricting the intake of phenylalanine and supplementing the diet with tyrosine could resolve the symptoms. This is because this essentially bypasses the step catalyzed by the enzyme phenylalanine hydroxylase. However, further in the question stem, we're told that after this recommendation, the boy's condition worsened. This suggests that his symptoms are likely due to a dihydrobiopterin reductase deficiency rather than a phenylalanine hydroxylase deficiency. So, returning to the overview slide, we can see that a deficiency of dihydrobiopterin reductase could also result in phenylketonuria. Okay, so now that we know his symptoms are caused by a dihydrobiopterin reductase deficiency, we're asked how smooth muscle relaxation in this patient would likely compare to that of a healthy individual. If we look at this figure, we can see all of the amino acids that require dihydrobiopterin reductase for proper metabolism. From the figure, notice that arginine is converted into nitric oxide. Recall from physiology that nitric oxide is normally involved in smooth muscle relaxation. In this patient, dihydrobiopterin reductase is deficient, which means he should have difficulty synthesizing nitric oxide. This means that smooth muscle relaxation would likely be impaired compared to a healthy individual. So, decreased smooth muscle relaxation. Okay, let's do another question. A 3-week-old boy is brought to the pediatrician for a follow-up visit. As the interview progresses, the mother brings up a concern about her boy's diaper appearing black after he urinates. An enzyme deficiency is suspected. What is a likely complication that will occur as this boy gets older? From the question stem, hopefully you notice that this boy's diaper is appearing black after he urinates. Black urine should immediately make you think of alkaptonuria. From this slide, recall that alkaptonuria can result in deposition of homogentisic acid in joints, which can cause arthritis. So in answer to the question, a likely complication that will occur as this boy gets older is arthritis.